Colleagues, we have formed a quorum. Let's begin the meeting. This is the panel on health services meeting on Zoom. So please note that you must switch on the Zoom video function and show your face. And the microphone will only be switched on at my instruction. During the video conference, you need to make use of either one of the three colors of background. If you would like to submit papers during the meeting, please send the papers to the email account of this panel, panelhs@legco.government.hk. Since the last meeting, there are papers issued after that. In fact, there is no information paper issued since the last meeting. Item 2 of the agenda, items for discussion at the next meeting. The Secretariat has already sent out the list of outstanding items for discussion reviewed by the government. This is CB-4207/2022-01 paper, and also the list of follow-up actions. In the next regular meeting, that will take place on the 13th May, Friday, 10:45 a.m. So the following items are proposed for discussion. Number 1, review of dental care services and relevant manpower plan. And number 2, control and prevention of coronavirus 2019 measures. If members have no other comments, then in the next regular meeting, we will discuss the above 2 items. Any comments, please? Right, then item 3. 3 projects under the first 10-year hospital development plan. All LegCo members are invited to join the discussion of this item because this item involves financial proposal. According to 83A of the Rules of Procedure, if members have direct or indirect pecuniary interest, and if they speak on that particular item, they need to declare the nature of the interest before speaking. Now let me ask the government to take us through the paper, and then members can ask questions. Chairman, members. So we table a paper today that is on the first 10-year hospital development plan, and there are 3 projects under that plan. We'd like to get your support. These 3 projects are main works for the redevelopment of Prince of Wales Hospital Phase 2, Stage 1. Number 2, main works for the redevelopment of Our Lady of Maryknoll Hospital. And the 3rd, main works for redevelopment of Grantham Hospital. For Prince of Wales Hospital redevelopment, Phase 2, Stage 1, the details are as follows. There will be 3 phases of works. In the first phase, preparation work, and Phase 2, demolition and foundation works have already started. Now we'd like to upgrade Phase 3 main works to Cat A. So it involves a new wing building, renovation and alteration of the main building and also innovation center, and to build link bridges between the new IPEB and the MCBTC and other associated facilities. So based on money of the day prices, the proposed project estimated cost is $23,679.6 million. And then about Our Lady of Maryknoll Hospital, there will be 2 stages. The first preparation stage work has been done. Now what we'd like to upgrade to Cat A are main works of Stage 2. Demolition of existing North Wing, East Wing and related outbuildings, construction of a new hospital block, refurbishment of the OPD building, landscaping, external works, utilities, diversion and road works, demolition of temporary building, removal of the cancer facilities and associated works after refurbishment of the OPD building. And based on MOD prices, the estimated cost is $4,348.7 million. For Grantham Hospital, Stage 1 main works, Well, the project will be divided into 3 stages. For phase 1 preparation work and phase 2 demolition and site formation and foundation works have started already. Now we'd like to upgrade to Cat A, and that is main works of phase 3. They include construction of a clinical block, including inpatient wards, ambulatory care facilities, and oncology center, operating theaters, and so on. And then a link bridge, construction of a university block. So based on MOD prices, estimated cost is $9,933.9 million. And total commitment of these are 30 billion. So in Q2, we will table the proposal to PWSC and FC. So I hope members will support these 3 projects so that we can start our works as soon as possible. Together with the hospital authority colleagues, we are happy to take your questions. Thank you. Thank you. Now, I will ask our helpers, for the sake of orderly remarks to be made by members, please clear all the raise hand signals first. If you would like to speak, please press the raise hand function on Zoom. So based on the number of members who would like to speak, I will determine the time limit. How can I see the number of people involved? Okay, it doesn't matter. So 4 minutes, including both the question and answer. I hope that you will reserve time for the administration to explain, okay? So I think the agenda today takes quite some time, and we need to leave time for members to ask questions about pandemic control work, okay? Right. First, Mr. Yang Wing-Kit. Thank you, Chairman. So the government proposed to redevelop Our Lady of Marino Hospital. I do not object to that, but then the government should adopt a long-term approach to consider the 10-year hospital development plan. In the future 10 years, well, hospital development should meet public needs. In Wong Tai Sin, there is an urgent need for an acute hospital. The redevelopment of Our Lady of Marino Hospital is an opportunity. I suggest that this redevelopment project and also Wong Tai Sin Hospital and also a school site can be redeveloped together into an acute hospital. In this way, Wong Tai Sin residents' needs can be satisfied. As we all know, Wong Tai Sin residents need to either go to QE hospital or UCH if they need acute hospital. And because of traffic, there is always traffic congestion. In the process, there will be easily accidents happening, and there may be loss of life. So I'd like the government to reconsider the redevelopment of Our Lady of Marino Hospital so that it can become an acute hospital. The government may say that it is backed by a mountain. It is not convenient. In fact, QM Hospital is also at Hilltop. So I think is for the sake of whether we want to consider it or not, so we can consider it to be turned into acute hospital. Kai Tak Hospital serves Wong Tai Sin, but then traffic is not convenient. It is very remote. If you go from Wong Tai Sin, Chi Wan Shan, and Chok Yun to that hospital, it is even more remote than going to QE. So I hope the government can reconsider. Under Secretary, thank you, Chairman. For Our Lady of Marino Hospital, it is part of the Kowloon, Central Kowloon cluster. Yama Te, Chim Sa Choi, Mong Kok, Wong Tai Sin residents are served. So in this cluster, there are many hospitals. In the future, the Kai Tak New Development Area Acute Hospital will be a acute hospital serving that district. So after it is completed, it can definitely serve Wong Tai Sin residents. For Our Lady of Marino Hospital in Central Kowloon cluster, it is one of the hospitals providing community specialty service and also outpatient clinic services. It is not only built near a hill. In fact, its area is very small, so it cannot offer the space enough for all facilities of an acute hospital. I can't hear you, colleagues. Can you hear the Undersecretary? Can I continue, Chairman? Yes, please continue. When Kwong Wah Hospital and United Christian Hospital are expanded, actually in the Central Kowloon cluster, the acute hospital service will be enhanced. So this can also help Wong Tai Sin residents. Thank you. Chairman, I would like to follow up. So all the hospitals you mentioned, we know about them, but then there is a lot of traffic congestion because the distance is quite long. So for Our Lady of Marino Hospital and Wong Tai Sin Hospital, and also the sites in between, can you consider using all this land to build an acute hospital? Then you can satisfy residents' need. Well, the purpose of the 10-year hospital development plan is to satisfy people's needs, right? Thank you. Well, your time is up, Mr. Yang. I want to tell you that what you said cannot be done in 10 years. There won't be a site that serves your purpose, and 10 years won't be enough. I want to ask you, do you support this funding proposal? Chairman, I don't object. Then do you support? I'm not asking whether you object or not. Do you support? Yes, I support. Undersecretary, thank you, Chairman. Let me add 2 points. First, traffic network. Of course, in Kai Tak, I think government departments are concerned about having a new large-scale hospital. They are planning on the traffic facilities. So concerning alignment and routes for ambulance and so on, we have been following up. So that's what we'd like to add. So now let me tell you, members who have raised their hand, Lee Sai Wing, Chan Pui Leung, Wong Elizabeth Kwok, Chen Yong, Lam Chun Tiu, Lam Mei Fun, Lam Chit Yun.
Next, Mr. Lee Sai Wing. Mr. Lee Sai Wing. Not here. All right. Next, Mr. Chen Kui Lam. Thank you, Chair. I'd like to express my support to these 3 projects under the first 10-year hospital development plan. Nevertheless, I'd like to raise some questions regarding the project. For this 10-year hospital development plan, I understand that the medical capacities will be enhanced, including an addition of 6,000 hospital beds and 94 operating theaters and so forth. In addition to the hardware enhancement, what about the software? Do we also have a corresponding enhancement of the software facilities, i.e., do we have enough medical staff, medical and healthcare staff in these new facilities to provide service? Well, according to the statistics of last November, there are 6.2% of brain drain problem among the doctors among the public hospitals, and about 6% of nurses in the public hospitals. So my question is that, do we have corresponding plan to step up with the provision of manpower in these facilities? Because I don't want to see the situation that we have only hardware ready, but without the software to support. So, Undersecretary, thank you, Chair. Thank you, Mr. Chen, for your question. The government accords great importance to the development of the healthcare services in Hong Kong, both software and hardware. So starting from the previous term of the government, we already have rolled out development plans for our healthcare and medical staff, and also have been recruiting new staff. We have been working hard to nurture local talents. In the past 10 years, the places for training of medical personnel in the UGC-funded institutions have increased from 1,300 to 1,900, and there are 20,000 odd non-subsidized places in the local institutions providing training for the healthcare personnel. There are also overseas doctors who could come to Hong Kong to practice. We have rolled out special measures. For instance, there are limited registration doctors who could practice in Hong Kong. We have also pay a lot of attention to maintaining existing staff in the public hospital. We have also tried to increase the promotion opportunities for the existing staff, and also given out incentive programs and so forth. Any follow-up, Mr. Chen? Yes, I understand that the government has done a lot. However, the result has not been very obvious. It seems that we still do not have enough medical and healthcare staff in our HA system. So I hope that you will look more into the effectiveness of your work. Thank you, Chair. Well, we have a 3-year review on the human resources situation in our HA system. Well, I've mentioned policy and measures direction, but then for these 3-year review plan, it is very helpful for us to understand the actual situation of the manpower condition in the HA system. Next, Mr. Wong Kwok. Thank you, Chair. I am chairman of the Medical and Healthcare Committee of the DAB. I agree to what Mr. Young said. For the redevelopment of the Our Lady of Marino Hospital, there should be it should also be developed into an acute hospital, because if it's not an acute hospital, residents in Wong Tai Sin will not have enough medical services, because they won't have enjoyed the 24-hour around-the-clock acute hospital services. There are a lot of private hospitals that are providing 24-hour services to its customers. So I wonder if OLMH could also consider that. And also, I'd like to know whether the plot ratio has been used properly in the redevelopment of OLMH. If OLMH can increase or add one more story to its building, there would be an increment of 100 hospital beds. As we understand, during the COVID situation, we can see that there are a great lack of hospital beds in Hong Kong. And also in Wong Tai Sin district is an aging district. So I wonder if OLMH could also provide services for the elderly. We have the Children's Hospital in the Kai Tak district, but then for Wong Tai Sin, we have a lot of elderly residents. There are a lot of people suffering from chronic diseases. So I wonder if OLMH could be expanded and provide services for the elderly as well. Thank you. Senator Secretary. Thank you, Chair. I will answer most of the questions, and for the plot ratio issue, I will leave it to the HA to answer. For the OLMH, they have outpatient service and also night services. So the HA will continue to review whether these services could be stepped up. Of course, outpatient service is different from the service of an acute hospital. It's very different. So if residents think that they could go to an outpatient clinic even in the middle of the night, they may not be able to receive medical services of an acute hospital because it's a completely different. And as we all know, time is of the essence if there are acute situation happening. So they really should go to an acute hospital. As we understand, in Kai Tak district, there will be a major acute hospital, and that is where they should go if people are having acute medical situation. So we understand that Hong Kong is an aging society. So the HA has, in its different hospitals, been providing services for the elderly. And I believe that this is the HA will continue to look into this. Or Ms. Lee, would you talk about the plot ratio issue? Well, Kai Tak Airport has been moved to Chek Lap Kok, but then the plot ratio still exists. In the previous two incidents, when we were in the LegCo panels, we heard members stating that they want to have hospital beds increased. So we try to fight for a release of the plot ratio. So now the bed increment is now up to 145. Well, have they released the plot ratio requirement, or have they just released the height control? Well, we have not used the plot ratio to the maximum. It's just the height of the building. Mr. Wang, does DAB support this proposal? Yes, we do. All right, next, Mr. Elizabeth Kwok, Ms. Elizabeth Kwok, or Dr. Elizabeth Kwok. Thank you, Chair. I do agree that Hong Kong is suffering from a serious lack of hospital beds. As mentioned by many colleagues, it is not enough to have the hardware enhanced. We do need an enhancement of our software as well. That is, hospitals, facilities, and hospital beds are not enough. We do need more medical and healthcare personnel. I think the government has not been answering our questions adequately. We have amended our legislation. We have allowed non-local doctors to come and practice in Hong Kong. But what is the progress of these measures? Have we been seeing an increment of overseas doctors coming to Hong Kong? How many overseas doctors have come to Hong Kong? We understand that the hospital authority has many pain points, especially during the COVID situation. So in the redevelopment plans, will we perhaps address these pain points and see whether we should step up with our facilities, for instance, in the acute hospital or in the A&E departments? We could have more facilities to provide services for the infectious disease patients. And also the CE mentioned that Hong Kong will try to make use of Chinese medicine so that we can provide better services to the patients through Chinese medicine and Western medicine integrated. So in the future, hospitals, or in the expansion and redevelopment of these hospitals, do we have provision for this? Under the new buildings, do we have facilities for Chinese medicine services or Chinese medicine practitioners to provide service to the patients? Under Secretary, please. Thank you, Chair. And thank you, Ms. Elizabeth Huat, I will answer your third question first. For Chinese medicine, as we all know, well, as we are facing COVID now, we have come to understand that actually Chinese medicine could help a lot in easing the problem, and it is a good opportunity for us to solicit the help from Chinese medicine practitioners. And it's really a good opportunity for us to see how CM, Chinese medicine, and Western medicine could be integrated. We do have a Chinese medicine hospital being constructed in Chongquan-O, and that would be the first hospital to provide local training for the Chinese medicine students. And it also provides a research base for Chinese medicine in Hong Kong. And I believe that this will help a lot to the future development of Chinese medicine in Hong Kong, and we will be more equipped to provide CM services to the local residents. Regarding infectious diseases, after SARS in 2003 and COVID in the last 2 years, the hospital authority has already stepped up its facilities. It's actually provided us with good opportunities to learn. When we look at the A&E department, in the old hospitals, because of the limitation of space, we have not been able to provide services for triage or providing services for infectious patients. But then in future redeveloped hospitals, we will be able to provide these space. And also we have relaxed our measures to allow overseas doctors to come practice in Hong Kong. The situation is progressing well. Well, Chairman, I'm actually asking whether there will be facilities for Chinese medicine in the future redeveloped hospital. We're talking about the Chinese medicine hospital. No, I'm not talking about the new Chinese medicine hospital. I'm talking about these existing old hospitals that you're going to redevelop. Well, after they are redeveloped and expanded, will you provide extra service or additional service for the CMP, for CM in these facilities? Dr. Young, thank you, Chair, and thanks, Ms. Huat. We do have collaborated service of CM and Western medicine to provide service to the patients under our clusters of HA. For instance, in treating pains and also the follow-up measures for cancer patients. The views expressed by Dr. Kwok, we can bring back to HA and see whether we could further step up with the collaboration between Chinese and Western medicine doctors. Thank you.
DAB supports this proposal. Next, Mr. Chan Yong. Thank you, Chairman. Thank you, government officials. Ms. Elizabeth Quad of DAB made her points. I am in agreement. Perhaps later on, government officials can continue their answer. I support this funding proposal because the direction is beneficial to the public. Well, this is now a turning point of the pandemic. And in fact, we have learned many lessons concerning, for example, bed spaces, outdoor, and inadequate manpower. Many reports said that many patients stay at home and use Chinese medicine to treat themselves, and they do self-test and self-isolation and so on, including LegCo members. So when you learn these lessons, how can you incorporate these lessons learned? And in terms of management KPI and progress, has there been delay in the future? Are you going to increase funding? How big will be the increase? Besides, for this project, based on the actual circumstances, in terms of resources and space, how much more Chinese medical doctors and external medical professionals will be added? Mr. Chan, just now, the administration has answered all questions of Ms. Elizabeth Quad, so I don't think they have anything to supplement. Right, so now, Undersecretary, My understanding is Mr. Chan would like to know that during the pandemic, in terms of use of hospital hardware and other supporting facilities, how can we improve future plan? I'll invite Dr. Yang to share experience in the past few months and see whether there are some new insights. Dr. Yang, thank you, Chairman and Undersecretary. Thank you, Mr. Chen, for the question. In the past few months, we can see that when the outbreak of pandemic is very fast, then in terms of treatment facilities and manpower of hospital, there is huge pressure. However, we believe that community treatment can also tie in with the overall work. Let me concentrate on hospitals. In terms of future facilities, we will add negative pressure wards and also isolation facilities as much as possible if there is the chance. For example, in the first 10-year hospital development plan, we are thinking of adding more facilities so that there will be no less than 320 isolation wards or rooms. These rooms will be for 1 or 2 patients. They are tier 1 rooms or wards. In future projects, under the first 10-year plan, we know that some patients are not only infected, they need to undergo surgery. So we are thinking of tier 2 wards. So if funding permits and if area permits, then we will enhance facilities so that there would be no less than 300 beds in the tier 2 wards. And then Mr. Chen referred to KPI. In hospital authority, regarding service of Chinese medical doctors, well, there is a 3-way cooperation. So we need to explore with NGOs how to improve the service. So we have paid attention to that. So that's all from me for the time being. Thank you. Undersecretary, any other points? Chairman, thank you. Any more supplements? No? Nothing from me. Thank you. Next, Mr. Lam Shun Chiu. Thank you, Chairman. Undersecretary, government officials, good morning. I will support these 3 projects. Just now, based on government officials' answers, I think that the direction is fine. Now, regarding the 5th wave of COVID-19, well, if you look at some facilities like negative pressure wards and isolation facilities, they are not enough. In the future, it is possible that there will be the 6th, 7th, or nth wave. So in the new design, if we provide for many negative pressure wards, the cost would be very high. So in the new design, is it possible that we can be both defensive as well as being forward-looking? So can there be facilities like ordinary wards, but then if necessary, the pipelines can be turned into negative pressure? So I hope this can be considered in your design. Just now, Dr. Yang mentioned some numbers. Those are helpful, but still very inadequate. Now we face aging population with bigger demand, and there is inadequate manpower in terms of medical workers. So in terms of development of smart healthcare, I think more importance should be attached to it in the plan. So now we are more receptive about telemedicine. So in designing hospitals, there are different systems that are related to future development, and these are very important. So I hope that the administration can pay more attention. And the third thing is the combination of Chinese and Western medicine and the training of Chinese medicine practitioners. This time in the pandemic, the public as well as the healthcare sector will have some change of perception of the role of Chinese medicine practitioners. In Hong Kong's history, Western doctors dominate, and concerning combination of Chinese and Western medicine, the mainland is developing faster than us. But because of the pandemic, we have a lot of reflections over the issue. In 2026, the Chinese Medicine Hospital will be commissioned, and at that time, there will be training of Chinese medicine practitioners. For Western doctors, apart from the two medical schools, I think Hospital Authority has also some training hospitals. So when we talk about these hospital works, they already have their plan and the layout, and in the future, there will be more work done on combination of Chinese and Western medicine. And in the new hospitals, there should be the function of training Chinese medicine practitioners. And with the smart hospital, I think there can be more combination of Western and Chinese medicine. Mr. Lam Shunqiu, do you support this funding proposal? Well, I said at the very beginning that I support. Thank you. Dr. Yang? Okay. Let me respond to Dr. Lam's points. In terms of design of hospital and preparation, of course, we hope that we will be able to be forward-looking. So both aggressive and defensive at the same time. So our colleagues are thinking of more space, and because some projects have commenced, there may not be too much room, but in the future, we will consider that. And regarding smart hospital and telemedicine, a few years ago, Hospital Authority started to build different systems. In the coming new hospitals, this work will be done. Now, it is not possible to change over at one go in all hospitals. But each cluster has its thoughts and ideas, and there's the need for central coordination, but then the overall trend and momentum is quite good. Concerning combination of Chinese and Western medicine and training, well, Hospital Authority is going to work closely with the coming Chinese hospital. So we hope to work hard in terms of developing medical professionals. Next, Ms. Leung Mei Fan. Yes, Chairman. I am absolutely in support of this funding proposal. In 2016, I myself, in every year's budgets and policy address, said that I hope the government will have long-term hospital plan, 10-year plan. In 2016, they actually provided $200 billion to pay the bill, so to speak. Okay, so this time I want to say that this time you have some plans to build a number of big hospitals. However, after this pandemic, I think the government in implementing this 10-year hospital development plan needs to have another 10-year hospital development plan. In the Northern Metropolis, the Development Bureau said that there will be a large-scale hospital with all specialties covered. And then there will be 30% people who are over 65 years old soon. And then for the Tomorrowland Town, there will be people moving in starting 2030. So are there hospital facilities there? Do you have any long-term plan? Now, for the 200 billion, I think all those projects in your list will be using that amount up. And then today, you have presented 3 more new projects. We welcome those. So do you need to think of the next 10-year hospital development plan, including concern about aging population and also infectious infectious disease hospital. In the 2003 SARS report, that proposal was made already. And this time we are still under the pandemic, but then things are still chaotic. There is no centralized arrangement. Now during the pandemic, the virus mutates every day. So do we need such a plan? In fact, we should plan in greater detail for future aging population. There are two major infrastructural works, Lantau Tomorrow and the Northern Metropolis, right? Undersecretary, thank you, Chairman. Thank you, Ms. Leung. As Ms. Leung said, funding for the first 10-year hospital development plan has been offered, and most works have already commenced. And for the 10-year HDP, funding is available already. Well, at first, we had some ideas, but then those are about the future. And now, with the plan and overall population distribution trend with the North Metropolis, I think the details need to be adjusted. We will work closely with hospital authority to tie in our work with new population trends. And then regarding aging population, this is a big challenge for all countries in modern world. Apart from hospital and hardware, I think the overall healthcare system is important. Prevention is better than cure. And then for primary healthcare, how can it play a better role so that there will be less pressure on hospitals from aging population? I think this government and the future government needs to consider this as an important area of development. Chairman, I only have little time left. I want to follow up. Can you let him complete his answer? Chairman, can you let me speak? I 100% agree to this hospital development plan, but then Undersecretary, I hope that you will clarify the message. I don't want you to only adjust resources. There should be additional resources. There should be another 10-year hospital development plan. Ms. Leung, you have used up your time. Yes, I know. Okay, I have finished my point, Chairman. So let's not waste further time. Okay, please do not interrupt further. Undersecretary, any quick answer? Chairman, thank you. For the second 10-year hospital development plan, we have initial funding, but do we need to adjust the content? We'll follow that up. Next, Mr. Lam Chi-yun. Thank you, Chairman. I support the funding proposal. Regarding redevelopment of hospitals, I hope that there won't be impact on patients' rest and healthcare workers' work. If you now go to UCH, well, that is a construction site, and healthcare workers and patients have hard time. I don't want this to happen again in redevelopment of hospital. Just now, Dr. Lam mentioned telemedicine. I know that in building hospitals, well, there will be a lot of other issues. So apart from telemedicine, well, you need to make sure that members of the public can see public hospital doctors via telemedicine, and then they can get medicine in the community, and they can get X-ray test and blood sample test and so on in the community. Have you considered that? And concerning prescription restriction, can that be adjusted so that doctors can make use of digital means to do prescription so that members of the medicine can get medicine in the community? Thank you.
The Secretary. Thank you, Chair. For the ongoing redevelopment projects of the hospitals, well, a lot of the works are being carried out in the existing hospital. It is a very challenging project because Hong Kong is a small place, and it is difficult for us to locate a completely new plot of land to build a new hospital. So most of the projects, redevelopment projects, are done on the existing hospital blocks. So we have to, of course, first try to minimize the disruption to the patients in the hospital. If possible, we will add some temporary facilities next to the existing building and try to find decanting space. We try not to interfere the daily operation of the hospitals. For instance, we would not affect the working of the equipment in the hospital labs and also operating theaters and so forth. And also for the transfer of patients and also safety of the people's traffic, all these we have taken into consideration. We thank Mr. Lam for his advice. Of course, the HA will pay great attention to minimizing the impact or disruption to the patients and the staff working in the hospital. Members have pointed out the need of corresponding legislation and also enhancement of software so that our existing hospitals can be better equipped to provide a service to the patients. Thank you. Any follow-up from Mr. Lam? No, thanks. Next, Mr. Leong Hei. Thank you, Chair. First, I support the funding proposal. A lot of colleagues mentioned about the need to provide acute hospital service in the Our Lady of Maryknoll Hospital. Well, I understand that there will be a piece of land that will be available nearby. So I wonder if the OLMH would consider having that piece of land to provide acute hospital service, because for the people in Kowloon City or Wong Tai Sin, they would have to go very far to receive the acute hospital services. Well, this point has been raised multiple times. So, Undersecretary, would you perhaps briefly answer that? Yes. Regarding the Wong Tai Sin, Sha Tin Yau, the facilities, the water treatment facilities that will be moved, we have to discuss with the development department to see whether the piece of land will be used for other purposes. And for the Wong Tai Sin Hospital, it is also along the hillside, and there may be a need for a redevelopment or expansion in the near future. So we will look at all these in one go. Next, for acute hospital, of course, in making design for redevelopment, we have taken this into consideration, and that's why in Kai Tak District, the new hospital will provide acute services to the people in Kowloon, in Central Kowloon, Wong Tai Sin, and Kowloon City, and so forth. Mr. Leong Hei, any follow-up? No? Okay, thank you. Next, Mr. Wong Yin San. Thank you, Chair. Undersecretary, Chairman, I'm in support of this funding proposal. As a matter of fact, when I look at the number of hospital beds mentioned on the paper, we can see that there is a great, it's lagging behind. Even after this new 10-year hospital development plan, we still cannot meet the standard of 5.5 beds per 1,000 people. So we are still lagging behind. So I really hope that we can try to squeeze more places so that we can provide more hospital beds. There might be second-tier hospital wards and so forth. I have two questions. First, I heard HA saying just now that the OLMH will, after redevelopment, the number of beds will be increased from 56 to 145, but on the paper, it says that 201 beds will be provided in the redeveloped OLMH. So should it be 145 or 201? This is a question of clarification. Second, for OLMH, there is an increase of hospital bed, but for Grantham Hospital, it's increased from 0 to 100. But for Prince of Wales Hospital, there's no increment in hospital beds. The number stays at 450. How come? Why is it So after these 10-year HDP, we are still lagging behind in hospital beds. For the Prince of Wales Hospital, it's 1.9 million square feet. It's a spacious hospital. So can we do some redesigning in the hospital so that we can have more space to provide more hospital beds there? Because it is better to have more beds provided in the hospital rather than just having makeshift beds as what we are seeing now during the pandemic. Is it possible for us to have more beds in the Prince of Wales Hospital? Undersecretary or Dr. Yeung? Regarding hospital beds, I think I would defer it to Dr. Yeung or Mr. Lee. Thank you. I'd like to defer this question to Mr. Lee. Thank you, Chairman. Just now I said that the number of increment 56 to 145 is actually the number of increment. At first, we plan to increase 56 beds, but then eventually we've decided to add 145 beds. So in total, there will be 437 beds in OLMH. There are two stages actually. In the future stage, there may be more hospital beds included, but then also because of the development of the North Metropolis project, we are still evaluating the needs for hospital beds then. On the paper given by the administration para 8, it mentions that in OLMH, it is talking about the increment of beds. So it's mentioned 201 beds will be increased. Why is it that you said that only 145 beds will be increased? I think I'll ask Mr. Lee to answer this question. For OLMH existing, there are 235 beds in OLMH. Before increasing its height, we plan to increase 56 beds. Now that the heights can be relaxed, heights requirement relaxed, so we can have 155 beds increased. So for the new hospitals, there will be altogether 436 beds. So what is the net increase? Net increment is 185 beds plus 16 hemodialysis beds. So the net increase is 201, correct? Next, Deputy Chairman. Chair. Thank you, Chair. I have a few questions. First, on the paper Annex 1 for the Prince of Wales Hospital project, there will be a new wing. So the new wing, what is the number of the isolation beds? Will you increase the number of isolation beds there because in view of the pandemic situation in Hong Kong? And second, about Wong Tai Sin Hospital and the OLMH and the Buddhist Hospital. All the residents in the community have to rely on Kwong Wah Hospital and also the new acute hospital in the Kai Tak. Do you know how long it will take for people to take a MTR ride from Wong Tai Sin to Yamate to Kwong Wah Hospital, and also from Wong Tai Sin to Kai Tak Hospital? Do you know how many MTR stations they have to go through before reaching Kai Tak Acute Hospital? We're not really asking you to convert OLMH into an acute hospital. We're just asking that when you look at the 18 districts in Hong Kong, we really hope that you can find another plot of land to build an acute hospital for the Wong Tai Sin district, for residents in Wong Tai Sin district, but not the Kowloon, Central Kowloon district, so that they can receive acute hospital services. That is, they can reach the hospital within 12 minutes in Wong Tai Sin district. If you can't achieve this in the this 10-year HDP, can you perhaps tell us, or at least commit that in the future, in the next HDP, you will try to find another plot of land to provide the acute hospital service for the Wong Tai Sin residents? We have been talking about these issues for many, many years. I'm not asking you to convert OLMH into an acute hospital. I am asking you to find another plot of land to build a brand new acute hospital for Wong Tai Sin. Well, Deputy Chair, we are talking about these. Perhaps we can talk about this in our internal committees. We are not talking about this issue today. Well, Chairman, if they do not have a plan, well, this has been answered multiple times. Under Secretary, please. Thank you, Chairman. Regarding the issue of how acute hospital can provide services effectively to local citizens, well, we have to actually consider how to give full play to the strength of our cluster system. We do have hospital clusters for different districts. So when Kai Tak Hospital is commissioned, we will be able to provide service to residents in the neighboring districts. We can have supporting services from the fire service department and so forth. So this is a kind of integration and coordination of the services of various government departments. Regarding Prince of Wales Hospital, can we have more isolation beds? I would defer this to Mr. Lee or Dr. Young. Well, at this stage, we have actually maximized the development, so we can't do it at this stage. For the second stage, we could perhaps review this and see whether we can increase more isolation beds in Prince of Wales Hospital. Deputy Chair, are you in support of the funding proposal? I want to hear all the response from the administration first. Chairman? Chairman, can you hear me? Chairman, can you hear me? I have turned on my microphone. Yes, I can hear you, Under Secretary, but I can't hear the Chairman. Chairman, can you hear? Okay. Can you all hear me now? Yes. Well, Deputy Chair, I want to ask you if you are in support of the funding proposal. I want to hear all the answers from the administration first. Well, we don't have much time. Your time is up. Under Secretary, any supplement? No, thanks, Chairman. No more supplement. Are you in support? Oh, well then, yes then. All right, next, Mr. Tang Fei. Thanks, Chair. I am in support of this funding proposal, though I'm not a member of this panel.
I agree with the Undersecretary. Now in public hospitals, there are Chinese medicine outpatient clinic. Mr. Tang, I can't see your face. You can't see my face? Oh, sorry. Is that okay now? Yes, I can see you now. Please continue. Right. I agree with the Undersecretary. In public hospitals right now, there are already Chinese medicine outpatient clinics. This is true. But I am not only referring to ordinary Chinese medicine ODP. The media yesterday reported that in the state's 14th five-year plan, there is an important measure. In public hospitals, there is Chinese medicine fever OP outpatient clinic. So I want to know, in the 10-year hospital development plan, do you have plan that in public hospitals there won't only be Chinese medical doctors treating chronic illnesses or functional illnesses? By setting up fever outpatient clinics, then Chinese medicine can also be incorporated in the treatment of sudden communicable diseases like COVID-19. Yesterday, the media reports said that in the 14th five-year plan of the state, experts have given suggestions to Hong Kong that we can also help scientific research on Chinese medicine so that there can be consideration on fever-related outpatient clinics. Undersecretary, well, concerning this topic of fever outpatient clinics, I think we need to look into the purpose that we'd like to meet. In the past 10 odd years in Hong Kong, there were different communicable diseases that threaten public health. For example, flu, seasonal flu, or avian flu, SARS. So in terms of hardware design, in cases of fever or in case of suspicious communicable respiratory diseases, in terms of hardware design in the past 10 years or so, things have been improving. So in terms of ventilation and compartments in outpatient clinic, can there be isolation or separation between those with infection risk and those without? So this is about hardware. And then for medical professionals trained in different streams, that is Chinese and Western medical doctors, how can they offer service in isolation facilities? I think this is future discussion about cooperation. Now, the Chinese medicine hospital is underway, and there is cooperation between the two streams, especially under the pandemic. So I guess hospital authority will do more to develop not only in Chinese medicine hospital and also Chinese medicine outpatient clinic. I think there will be more detailed consideration. Thank you. Ms. Lee, you are the last one. Thank you, Chairman. First of all, the government is not taking on board public views about setting up A&E near Our Lady of Marino Hospital. I find it regrettable. It is no use to argue further because the administration has answered many times, but I want my point to be recorded. Now, Kai Tak Hospital in the future will serve Central Kowloon residents, but I want to say that Kai Tak Hospital, after being commissioned, will take over from QE Hospital many functions. I'm worried that the capacity is not enough to satisfy the aging population needs in Kowloon. I hope the Undersecretary can promise me two things. Number one, in the future, QE Hospital can keep its A&E function and other medical functions. And these functions can be opened to the public so that the public can continue to see doctors in QE Hospital. Number two, for Our Lady of Marino Hospital, concerning the barrier-free facilities, well, after redevelopment, there won't be A&E department, but many members of the public will go there for follow-up visits. Now, many people said that the access is not up to standard. So I hope that the Undersecretary can do more study about that. And in the future, you can work with the Secretary and other relevant departments. Undersecretary. Thank you, Chairman. Regarding Central Kowloon A&E service, in fact, now Kwong Wah Hospital is being expanded after expansion in terms of beds and A&E service and hardware. All these will be greatly enhanced. And then there's also UCH Hospital that is being expanded. There will be a bigger A&E department. So when the Kai Tak Acute Hospital, Kwong Wah Hospital, and UCH are all expanded, then in Kowloon, Central Kowloon, and also neighboring areas, there'll be improvements to the A&E service. And this can help satisfy people's needs. For Our Lady of Marino Hospital's geographical position and access, I know that there are some limitations. Vehicular access will be improved. After this meeting, we will work with hospital authority to see what to do on barrier-free accessibility. Chairman, I want to follow up. Thank you, Undersecretary, for the promise on the second point, but I'm not happy with the first point. For QE Hospital, it is the first hospital to handle COVID-19, and members of the public are very familiar with the hospital. It has good geographical location. I hope the administration can promise that QE Hospital in the future will be opened to the public after expansion. A&E can continue to serve the public. In Hong Kong, population is aging, and there's a lack of other specialties like medicine and other medical service. You may not be able to answer me today, but I hope you will do more study after the meeting. And at PWSC, I hope you can give a clear answer. If so, then I guess the public will be happy to accept and support this proposal. Can you promise me to do some study and give us an answer in PWSC meeting? Undersecretary, number 1, will you study? Number 2, will you be able to give an answer at PWSC meeting? Chairman, we will try our best. For the original site of QE Hospital, it will still be providing medical service. Chairman, one more point. Ms. Lee, sorry, your time is up. You have used up your time already. Please mute her, okay? Undersecretary, I want to say that the Liberal Party is in support of this funding proposal. So we will conclude discussion of this item. Thank you, government officials and hospital authority colleagues. Agenda item 4, proposed amendments to the Declaration of Mental Hospital Consolidation Order CAP 136B. All LegCo members are invited to join this discussion. I will ask the administration to brief us on the paper, and then members can ask questions. In order to have orderly discussion and fair discussion, I would ask our colleagues to first clear the raise hand signals already pressed by members. If you have the intention to speak, please press the raise hand function on Zoom now. I will determine the duration or time limit for each member after knowing the total number of members who would like to speak. Now, can the administration please brief us on the paper? CB 4207202205. Chairman, members, all along, we have been offering medical services to the medically ill. So considering the severity of the disease and needs, we will offer community support service and treatment. According to 3(1) of MHO, the CE may, by order, declare any place which is the property of the government to be a mental hospital for the detention, custody, treatment, and care of mentally disordered persons. So to satisfy the need of service of Castle Peak Hospital, Kwai Chung Psychiatric Observation Unit, and Pamela Yu Northern Seoul Eastern Psychiatric Observation Unit, New Territories East Psychiatric Observation Unit, and Kowloon Psychiatric Observation Unit, we need to gazette to set up or de-gazette certain of these hospitals. We need to go through the technical legislative process. And then according to the amendment order, well, we are going to submit to LegCo in the way of negative vetting. Based on legislative progress, we hope that in July 2022, the order can take effect. So, Chairman, our colleagues will be happy to listen to your comments. Thank you. Okay. Only 2 colleagues have raised their hands. 4 minutes each. Ms. Leung Mei Fun. Thank you, Chairman. I support this item because mental health is very important to Hong Kong. At the beginning of the pandemic, that is 2 years ago, I received from many experts and medical workers and members of the public comments that, well, yes, the virus may infect many people and many people may die as a result. But then in our society, there is strong mental pressure. Well, in other places, like some big cities on the mainland, there has been outbreak, but then they attach much importance to mental health of residents during recovery and during isolation. They said that for every 100 persons, there should be one mental counseling or treatment service. So there should be consultation or some counseling. And in case of isolation, there should be one phone call a day, because not everybody can adapt to isolation and can get over or overcome the fear. Well, in Hong Kong, for every 10 persons, there is one who suffers from depression. Well, that may not be related to the pandemic, but then after the pandemic outbreak, how are you going to tackle the sentiment and environment in society? Because that is not good to mental health. Depression is very serious. So apart from these rather piecemeal proposals, are you going to have further plan? You may not have enough time to do it in the fifth wave, but in the long run, are you going to increase community mental health service, especially for patients who have been infected by the pandemic and also their family members? Undersecretary, I hope to get your response. Thank you, Chairman. Thank you, Ms. Leung, for your concern over the public and also COVID patients and their family members, especially their mental health. This is a very important and broad issue for the public. Before the pandemic or now and in the future, under the pandemic, there are so many social distancing measures, and there are many waves of the pandemic. As a result, there may be emotional problem. So concerning the mental health steering committee set up by the administration, a lot of concern and attention has been paid to this matter, and funding has been made available to organizations to help the public and also offer mental health support and services. This is underway. And for the patients in community quarantine facilities and isolation facilities, if they have emotional or mental problems, well, the SWD has hotline and hospital authority also has hotline. And during communication, when we identify some emotional problems, then appropriate counseling and referral will be made. Thank you. I think the Undersecretary's answer is not precise enough. I hope that you will work out some numbers about different age brackets. Funding only is not enough. You need to have enough trained healthcare workers to deliver the service. For example, for every 100 residents, there should be one mental counselor, for example. Ms. Leung, you have used up your time already. If you have other details or other questions, I think they can give you a written reply later. You can write to the Undersecretary later.
Next, Mrs. Regina Yip. Mrs. Regina Yip. Thank you, Chair. Well, this paper is actually it's just some technical amendment. There are some wards de-gazetted and some hospitals de-gazetted and so forth. I'd like to know whether the Undersecretary has some numbers for us, some data for us. Since 2020 January, with the outbreak of COVID-19, do you have any numbers? How many people have committed suicide since then? Well, after talking with people, I understand that there are actually quite a lot of people who have committed suicide during in the past 2 years. Well, of course, not all of them, or not all the deaths are committed or are related to COVID-19. But then I know that there are at least 2 elderly ladies who committed suicide because they have learned of the fact that they have committed they have contracted COVID-19. Well, also there are some people who like to go on hiking during the pandemic period, but then there are some accidents. I learned that there's one 30-year-old young lady who died while hiking alone. So I wonder if the Undersecretary has any relevant numbers since the start of the pandemic. How many people have committed suicide, or how many people have sought help or have suffered from emotional problem because of that? Undersecretary? Thank you, Chair, and thank you, Mrs. Yip, for your observation and suggestions. Yes, indeed, we understand that we have to pay attention to those non-natural deaths. And we would need to collect data on those cases. I don't have the numbers at hand today, but I will definitely go back and try to understand the situation further. Well, Mrs. also mentioned about research and studies. Yes, I understand that there are some medical and healthcare institutions that have put forward research proposals. I would go back and investigate further to see whether there are, for instance, universities that have submitted proposals for conducting research and studies on these issues. Well, Undersecretary, perhaps you should provide us the following data. Since 2020 January, with the outbreak of COVID, what is the number of suicides? And comparing with the previous years in Hong Kong, the suicide situation in Hong Kong, and also the deaths the deaths during hiking. I also know how many were dead while hiking. And this actually could show how COVID have affected the people of Hong Kong. Of course, some research institutes might be interested to conduct studies. Yes, the Undersecretary will provide these numbers to you after the meeting. Ms. Elizabeth Kwok. Thank you, Chair. The proposals is very technical, and anyway, I am in support of the proposal. Talking about mental hospital, of course, we very naturally would think about the mental situation among the people of Hong Kong during COVID-19. The pandemic has struck us for more than 2 years now, and during this period, we understand that people have to stay home, and this actually would be very challenging to many of them, especially for those suffering from mental or emotional problem. And there are some quite a lot of elderly people who have committed suicide because of COVID-19, and this is really very tragic, and it's something that we don't want to see. And we really hope that the government could take care of the emotional and mental health of the people of Hong Kong. And yes, of course, you mentioned that there are hotlines of the Social Welfare Department. However, can the hotlines be available? Very often people say that they can't get through the hotlines. So if you say that you will go back and study, I don't know how long you would need to study the situation. Well, for this kind of services, it should be provided in a timely manner. And I think we have to be flexible. You do have enough manpower in the government, right? I hope that you would really face this problem squarely and collaborate perhaps with some professional bodies so that you could provide more hotlines for the people of Hong Kong so that the needy people can get timely help. For mental health in the HA system, I know that people have to wait for a long time in order to get consultation or medical consultation. because this is not regarded as acute situations. So people have to wait for a long time to see a doctor if they are suffering from psychological or emotional problem. Well, but then this is not ideal. Sometimes people may have to wait for up to 3 years to see a doctor. Well, especially for people like the young people or adolescents, this is way too long. And they may perhaps be suffering not very severely of the mental problem. But then if they have to wait for 3 years, you just imagine that would become a serious case. Are you lacking psychiatric doctors? These are the problems that you have to face squarely. If so, you may have to add more manpower. Well, colleagues, let me remind you that you are actually deviating from our agenda item. Well, if you're talking about policy issues, perhaps you should raise these questions at a different occasion, not at this meeting. We're actually talking about the proposed amendments to the Declaration of Mental Hospital Consolidation Order. Under Secretary. Thank you, Chairman. I'd like to thank Ms. Quat for raising these problems. And yes, we agree that we should provide timely service to the people in need. We have a funding project in 2021 July. We have rolled out a funding scheme. There are $300 million, and then 100 million has been allocated to support 70 projects, which provide services or activities to the people of the various districts in Hong Kong. In addition, we have Shall We Talk app, and this would have medical doctors providing or healthcare people providing services to the people suffering from mental problems during the pandemic. A speaker is not coming through. Turn on your microphone, please, Miss. The next should be Mr. Wang Yunshan. Okay, Mr. Holden Chow, it's your turn then. Thank you, Chair. Thank you. Regarding the technical amendment to the ordinance, I am in support of the proposal. I have a suggestion. You don't need to answer me, Under Secretary. My suggestion is that as many colleagues have pointed out, a lot of people are suffering from emotional problem during the outbreak, the 5th wave of the pandemic. Well, my observation is that there are a lot of people, for instance, who have contracted the pandemic, and there are people who have to go through isolation or quarantine, and also some of their family members have to undergo that as well. The situation has eased somewhat now. But then we have to face another problem. That is, there are some people who have lost their family members during the 5th wave. So I think we should really care for this group of people, the bereaved, who may be suffering quite a lot during this period. I think we should not overlook this group of people. Well, this is just my opinion. I don't think the Undersecretary needs to answer me. Thank you very much, Chairman. Okay. You have asked your question, right? All right. No need for the Undersecretary to answer. No. All right. Thank you. Mr. Wang Yunshan, are you still here? Mr. Wang Yunshan. No need. I'll wait for the next round then. All right, thank you. This would be the end of the agenda item. We would like to thank the administration for attending this meeting. We're now at the 5th item on the agenda, measures for the prevention and control of coronavirus disease 2019 in Hong Kong. Well, we have less time for this this item because we have overrun on the first item. Anyway, we will. The meeting will last till 1 p.m. and I will not extend the meeting for 15 minutes. So we have to end by 1 p.m. I would like to invite the administration to brief us on the paper. In order to have orderly discussion of the item, please turn off your raise hand function on Zoom first. Please clear all the raise hand functions, the raise hand symbol on Zoom first. All right, now for those who would like to speak, please press on the raise hand function. I will then decide how much time would be allowed for each member to speak. Would the government please walk us through the paper CB 4207 2022-07. Thank you, Chairman. Members, since the fifth wave of the pandemic, positive cases have exceeded 1 million. The government has mobilized all its resources to tackle the pandemic, and our goal now is to reduce the death number, reduce serious cases, and reduce infection. And we also have tried to mobilize our resources under the HA so that certain hospitals can be designated as a specialized COVID-19 hospital, and that is to avoid the patients or prevent the patients from developing serious symptoms and becoming serious cases. The government is very thankful to the Central People's Government for its steadfast support. From February, we have started exchange meetings with the mainland experts, and the central government has given us a lot of support, and within a short period of time, we have received resources as well as manpower from the mainland. There are experts coming over to Hong Kong to assist Hong Kong to tackle the pandemic, and these experts are very experienced and they are really very helpful to the SAR government in tackling the problem. In the fourth batch of mainland experts arriving at the end of March include Chinese medicine experts, and they have also visited different provinces and municipalities to promote the use of Chinese medicine in tackling the COVID-19. So for Hong Kong, we could learn from these experiences and could make use of Chinese medicine to tackle the problem. And these experiences are very helpful. And of course, with the support of the central government, we focus our effort in reducing serious cases and death rates. We also try to maximize our capabilities. First, we have changed or convert some general hospital wards to become designated wards. We have also converted some hospitals into designated COVID-19 hospitals. And in order to focus our effort, the Queen Elizabeth Hospital has also been converted into a designated COVID-19 hospital since 13th of March. And there are about 1,300 beds in that hospital, and serious cases were admitted into QE.
So there is a support medical team from mainland China reaching Hong Kong in mid-March. They joined the hospital authority team. They work with local medical workers to offer treatment to the confirmed cases. With the help, hospital authority is enhancing community treatment facilities and the scale of service and also treatment quality. Number 3, in Lok Ma Chau, the Loop area, the acute hospital project is also underway with the help of the mainland expert team, and the relevant arrangements will be announced in due course. For most severe or dangerous or critical cases, well, they are already hospitalized, and based on the conditions of the confirmed patients, well, they are being triaged, especially concerning elderly patients. First of all, more elderly isolation and daycare services should be offered so that the normal condition patients can be handled. So for these centers, they are being operated by SWD, and right now, for those which are already in service, include 1,000 odd beds in AWE, and there are 5 indoor sports ground that are being modified into the center. For example, the center at the Kai Tak cruise terminal on 21st March, there are 1,200 beds offered, and they are commissioned in phases, and 400 beds already started operation right away. And then more support is given to elderly care homes and disability care homes. So there is strong requirement that they should adopt closed loop management, and there are designated hotels and vehicles carrying the workers to and from the hospital. And then there should be support to those symptom-free or mild symptom confirmed elderly patients. For example, better anti-epidemic packages are offered, and then there are support given to inquiries raised by the elderly workers. And number 4, for high-risk elderly patients and different groups, we are actually modifying some community isolation facilities at Penny's Bay in order to take in patients who can care for themselves and those accompanied by carers, and also children of the carers, so that during isolation, they can get the necessary care and supervision. And then for private hospitals, they are important elements in our healthcare system. The government welcomes and hopes that all private hospitals can work together during this critical period. They can also take up anti-epidemic work. Under the 5th wave, Hospital Authority enhances quota for public-private cooperation. And then public hospital beds, there is a big increase. So there is paid bed space facility and also new collaboration scheme involving private hospital. Patients are referred to private hospitals for treatment. On 30th of March, there are 264 hospital authority patients using private hospital beds. In terms of severe case treatment and also prevention, of course, medicine treatment is the most important. So Hospital Authority recently brought in the oral medicine for COVID-19. From MSD and also Pfizer. So the medicines have reached Hong Kong already. So these medicines are being prescribed by Hospital Authority. And then by means of borrowing other medicine, we help private doctors and other care centers to supply the above 2 mentioned oral medicines. Finally, in terms of guarding against importation of virus, the pandemic is still severe globally. And so there are very stringent quarantine and testing facilities for passengers on board flights. So in this way, there can be guard against importation of the virus. There can be a barrier to make sure that cases will not get into Hong Kong from overseas. Starting early March, there was a decrease in number of cases, and in Hong Kong, there is a big increase of quarantine, isolation, and treatment facilities. And there are some cases with no symptom or mild symptoms. So upon arrival, even if the test result is positive, there is not the need for people to be sent to hospitals. As a result, pressure has been alleviated. For the sake of Hong Kong people's interests and social economic needs, starting 1st April, that is today, the flight ban on 9 destinations will be abolished. But then the precondition is that those people coming back to Hong Kong have to follow all the stringent measures and be quarantined in the designated quarantine hotels. Apart from the above important points concerning our anti-epidemic work, we'll continue to strengthen all anti-epidemic measures. For example, more testing and tracing of close contacts, sewage inspection, and also social distancing measures, vaccination program, and so on. So here I would like to appeal to all Hong Kong public. We should work together and support the government in all anti-epidemic measures. As long as we work together, I'm sure we can fight the battle together. Thank you. Colleagues, let me concerning children's hospitalization for the government and hospital authority. Well, I think for families, I hope that they should not be segregated or isolated. But then in case of infectious disease, hospital authority has isolation facilities, but the overall strategy and the principle is not to separate them as much as possible. Of course, in some cases, there may be some challenge, for example, in ICU, for instance. So on one hand, the hospital authority promised that they will not separate parents and children, even if they are infected with COVID-19. However, they hope that there is some flexibility. So in case of special cases or in case in the ICU, when children are to be treated, then I think treatment is the first precondition. Even if there is isolation or segregation every day, doctors and nurses will communicate with their family members via video conferencing. Number two, I don't have the numbers with me on the number of children involved. As far as I know, they are usually in the ICUs. So we will go back to remind hospital authority again. Mr. Chan Kin Po referred to Chinese medicine. Well, in different treatments and on different people, for COVID-19 experts, they have come to Hong Kong. And in different isolation facilities, for example, mobile cabin hospital, close contacts, home or recovered cases, in different stages, different Chinese medicine can be used. So we will continue to do the work. But for Western medicine, those two oral medicines are very important. The most important thing is to have fast efficacy. So in designated clinics, elderly care homes, A&Es, hospitals, at different places, and even the temporary care centers, these medicines can be offered. The most important thing is speed. And recently, the guidelines have been further relaxed. As regards the curtail mechanism, on one hand, we have to be very careful. There are people who have stayed outside for a long time. We hope that they can return. On the other hand, based on our past experience, some flights may bring 20-odd people back to Hong Kong. And even though they have negative results before they boarded the plane, when they arrived at airport, they were tested positive. So we must have some mechanism so that the anti-importation of disease will not bring further pressure on our healthcare system. We will closely monitor the situation both abroad and Hong Kong, and we'll see whether there is further room for adjustment. Thank you. For numbers about children, perhaps you can give us the details later. Yes, I don't have the information with me now. Next, Charles Yeo-Kun and right. Thank you, Chairman. Thank you, Chairman. Secretary, I have two questions. First, about medical certificates. On 4th February in the manpower panel, your bureau has not sent any representatives, but then the paper is issued by your bureau and the Department of Health. So under 599, Cap 599, there are people who can't go to work. And if they require, Department of Health should issue medical certificates. But I've received many complaints. So far, I have not seen this medical certificate yet. And the Department of Health put the blame on hospital authority. Hospital authority put the blame on designated clinics. So can you explain what is happening with Department of Health? And then concerning the 10 free Chinese medicine clinics, well, the people can't get through the phone and there is no way for them to record their message. Can you give an answer, please?
Wait, please, Mr. Leong Hei. Please wait till Mr. Leong Hei answers his question. Thank you. Yes, Chairman. She mentioned that there will be universal testing, but then starting tomorrow, the government will try to give out the COVID-19 service kit. Well, if they have people have used up all the testing kit, I think they will panic. Perhaps the secretary can tell us when the universal testing exercise will start. And understand that some people do not want to report to the CHP after being tested positive. Can you perhaps give them a choice that they could stay home and do their isolation instead of being sent to the makeshift hospital for isolation? Secretary, yes, for medical certificate, I would like to defer that to Dr. Choi. He is from Director of CHP to answer that question first. Thank you. Under Cap 599, there will be isolation notice or home quarantine notice, or there may be a requirement for that person to stay home. We will send out relevant document for the isolation notice or quarantine issues that we have sent out. These could be used as evidence as the person can hand this document to his employer to prove that he has to stay home and can go to work. And if the people report to us online, there will be also online quarantine or isolation notice. Sometimes we send out the document through text through the smartphone. So we have issued these electronic documents. If members of the public need further follow-up, they can contact us. Secretary. Yes, the other question raised by Mr. Chow regarding the Chinese medicine clinic. You mentioned about the 10 free consultations. Is that the service for the recovered patients? Yes, correct. Correct, from the COVID recovered patients. Yes, this project has been going on because we have a lot of recovered patients now. So among the 18 Chinese medicine teaching and research institutes, they have been providing this service to the recovered COVID-19 patients. If the number continues to increase, we will perhaps consider providing the service through different government clinics. This is the first point. Second, Mr. Leung's question is regarding RAT, rapid antigen test. Starting tomorrow, we will distribute the anti-pandemic service bags to residents of Hong Kong. And in those kits, each family or each household will have 20 RAT kits. The CE has mentioned that we will give out the notice for the universal testing project if there is one. But then the members of the public do not need to worry. If they have run out of the RAT kits, they could contact us, and especially for the elderly people, because well, the situation may seem to have eased, but there are still a lot of transmission chains in the community. So we should not let our guard down, especially for the elderly people. It is good for them to conduct a test more frequently so that they would know whether they have contracted the pandemic. I'd like to remind you and your colleagues, please, in answering the questions, please be precise. Otherwise, we will be running out of time. Next to Ms. Chen Hoi-Yan and Leung Man Kwong. Ms. Chen Hoi-Yan first. Thank you, Chair. The government plans to have school resumes teachings on the 19th of April. Can you perhaps not set a date, but use the number of confirmed cases as the indicator? Well, as you mentioned that every day we still have quite a number of infected cases. And you mentioned that the universal testing will not be conducted. It's not a good time to conduct the the universal testing. But then why do you think that the classroom teaching should resume? And why do you think that it is the right time to resume classroom teaching? Because the school children may still be exposed to the risk of contracting the disease when they return to schools. And next, you mentioned about voluntary testing. Are you going to use RAT as a kind of testing mechanism? Next, Mr. Lang Men Kwong. Thank you, Chair. My question is also about class resumption. It looks as if this is about the Education Bureau. However, the guidelines given to the schools, including the healthcare guidelines, are all related to the Health Bureau. And one was issued in November, another one issued in January this year. So these guidelines are actually not very specific, just some recommendations for what they should do. Well, now we are facing a very rapid change of the virus. If the government is still just giving out advice in their guidelines, I think it is not adequate. Of course, first, I don't agree that there should be a universal resumption of classroom teachings on the 19th of April. Can we perhaps do it by phases? Second, for the confirmed cases, can we perhaps have a mandatory order stating that there should be a kind of compulsory testing so that they would be isolated and not allowed to go back to school instead of just giving them advice? Thank you, both members, for your questions. First, about resumption of classroom teaching. We are actually in a dilemma because on the one hand, the Education Bureau understands that classroom teaching is vital to the psychological health and emotional health of students. It is good for students to attend school. But then on the other hand, we have to take into consideration the pandemic situation. There are quite a number of people from the education sector who would like to, have urged the government to resume classroom teachings ASAP. And that's why the Education Bureau has set down a date to resume classroom teachings. Well, in addition to that, of course, we understand that we have to protect our children in the society. So we are now going all out in boosting the vaccination rate at schools or among young children. And the Education Bureau has given out outreach services to over 100 schools. Doctors would go to these schools to conduct a vaccination for the students. There are also vaccine pass, which is a strict requirement for the visitors and staff of the schools to comply. So all these are being carried out. Regarding the control of spreading of the disease in schools and follow-up action, the CHP and the Education Bureau has been discussing these issues very frequently. And of course, I don't have the guidelines at hand, but please understand that both departments, the CHP and the Education Bureau, are working closely together on this. Regarding whether RAT would replace the compulsory testing, the answer is no. We are using the golden bar, the RCP test as the golden standard. Why is it that we are using RAT so frequently now? Because the community is seeing a lot of confirmed cases, and that's why we're trying to do this through a two-pronged approach, both RAT test and the nucleic acid test and the PCR test. Ms. Alice Mack? Yes, Chairman. Yes, go ahead. Chairman, I have a few points to make. First, the Secretary mentioned about the residential care homes. There will be a closed loop arrangement for the RCHE. How can we ensure that the RCHE can be protected from the pandemic? How can we ensure that there will be lesser death case and serious cases in the RCHE? And second, the Qingming Festival and Easter festivals, Easter holidays are coming. What are the plans of the government to control traffic or controlled crowd gathering during these two festivals? I hope that the administration can have advanced planning. Of course, you have been appealing to the people not to gather to avoid the rebound. Your time is up. Next, Ms. Priscilla Leung. Chairman, I really hope that the Secretary would be frank and honest to us, especially for the school children. I noticed today that there is a report saying that for children infection, the children among the children deaths, for 3 among the 4 deaths are children without chronic diseases. So we're really very concerned about this. You set the date for 19th of April for the resumption of classroom teaching, but then the efficacy of the vaccination is 14 days after the injection. That means the 5th of April should be the deadline for all the children who have not received the vaccination to get a jab by the 5th of April. Is that so? Secretary, please answer. Thank you, Chairman. Ms. Mack's question regarding the RCHE, the closed-loop arrangement for residential care homes for the elderly. I'd like to defer this question to the perhaps to the Social Welfare Department. They will give us the latest number before I can answer this question. I would defer this question to the SWD and provide you with the figure after the meeting. The second question regarding the situation in RCHE. We have done a lot of work to protect the elderly citizens in RCHE. The residents there would have to do RAT every day. If they are tested positive, we will try to identify them. And there is a new measure under which these affected cases could go directly to the care center, the temporary care center, and they do not need to go to the hospitals or the before being transferred to the care centers. So these are the new measures. Regarding the Qingming Festival and Easter holiday, the upcoming festivals, we have been calling upon the people of Hong Kong to avoid going out or gathering in crowds and to avoid tomb sweeping on the day of the Qingming Festival. They could perhaps do it before or after the date. We really hope that the members of the public would pay attention because there are still a lot of infectious cases in community. We should not let our guard down. And the point raised by Ms. Priscilla Leung, that is the children's deaths or the death cases among the children, and also the resumption of classroom teaching. Yes, indeed. These are serious issues. We will defer your questions to the Education Bureau. And regarding vaccination program, we have been trying our very best to boost the vaccination rate. And we are providing outreach services to the schools to carry out the vaccination. And on the other hand, the CE has mentioned that we would try to step up with the vaccination drive by the end of April. We hope that there will be at least the first children about at the age of 12 or above will have at least received 1 jab by the end of April. We have outreach programs or services as well, going to the schools to do the vaccination for the school children. We will go all out in our effort to on this front. Thank you.
Next two, Mr. Lam Chit Yun and Mr. Chen Pui Lang. Thank you, Chairman. 3 questions. First, family doctors always face members' needs, public needs, and that is asking for medical certificate for leave? And also, what are some criteria that we need? Do we need isolation or quarantine order? Is a photograph showing negative test result or test result enough for the 2 oral medicine? Now you are deliberating with private hospital or doctors to see whether they can be used in the community. What is the progress and with whom are you deliberating? Before 26th February, many patients are confirmed, and for their close contacts till today, they have not received quarantine and isolation order. They need the orders to discuss with the employers. So when can they get the reports, and what ways can they use to chase after the reports? Mr. Yu Fat Leung? Chairman, thank you. Secretary, I understand that inbound control measures are something we cannot make light of, but then now I think the threshold is too low for flight suspension. It is not conducive to regular flight service, and it is difficult for members of the public to adapt to. There is further need for adjustment. Now, concerning flight suspension for 7 days, what is the calculation mechanism? Can you clarify? Besides, can the government offer a list? So which routes are being suspended now? Can there be a list concerning the city value, where there is difference between Hong Kong and mainland and Hong Kong and other countries? There are differences in standards in the city value. Are these differences still there? Can there be a response from the Secretary? If there is time, I would like to ask further. No more time, Secretary. Chairman, first question. I will ask Dr. Choi of CHP to answer the question regarding family doctors. So what guidelines are available for them to issue certificates? And also the third question, Dr. Choi, please. Regarding family doctors, to help residents to confirm their status. If the resident has already an isolation order, then that is the most clearest. But sometimes people want family doctors to ascertain. Now, if a resident shows symptoms, then he can do a test if he hasn't done so. And in past confirmed cases, well, no vaccination is received yet, then antibody tests can also be helpful. Antibody tests can show whether there is past infection. That's all from me. Secretary? Yes. Dr. Lam said that there are special cases that need follow-up. Well, people can contact us. Chairman, I would ask the hospital authority to comment on oral medicine and with which private doctors they have been deliberating. HA, please. Yes. For private hospitals, we are offering those medicines all along. When private medicine or when private hospitals ask for the medicine, we have offered. Now the medicines are used on 400 odd patients. And then for private doctors, we are waiting for D of H instruction. The medicine is there. If the government is ready, then we can offer the medicine to private doctors. Secretary, for Mr. Yu's question on flight suspension mechanism, I do understand that there are some airlines which prefer a more stable flight arrangement. So they hope that we can adjust our flight suspension mechanism. Well, on one hand, we have to be very careful because now global pandemic is still severe. We have to be careful with inbound control measures. So first of all, for those people who are overseas, who are stranded overseas, we hope that they can come back orderly. For the other cases, we will monitor the pandemic and see whether there's the need to adjust. Mr. Yu said, originally, suspension will last 14 days, but now 7 days only. So based on our mechanism, if there are people who are confirmed when they arrive, then that flight will be suspended for 7 days. As regards CT value, I will defer to CHP. So concerning CT value and a comparison with other places, CHP can comment. Dr. Choi, yes, I'll be brief. I understand members' worry. So upon departure, the test result may be negative. When they arrive, they become positive. So people are worried that the test may not be well coordinated. I understand. Incubation period of Omicron is short. So usually 24 hours after or before departure, they may be negative. And it is quite common to see that when they arrive Hong Kong, they become positive. When we see positive results, we will look at the CT value. Is it a new infection or is it a recurrence of the virus? Well, we will look at both cases. Holden Chow and Mr. Yang Wing-Kit. Mr. Holden Chow first. Thank you, Chairman. I will ask questions about vaccination of the elderly. We have learned lessons from the fifth wave. So I want to know, we want to reduce fatal cases and serious cases. Will the government legislate to make it compulsory for those over 70 years old to get vaccination? Because if we want to reduce death cases and severe cases, vaccination is a must. However, vaccination among elderly is still not satisfactory. So has the government considered this? Okay, Mr. Yang Wing-Kit. Thank you, Chairman. I have two questions about resumption of class in primary school. On 19th April, class will be resumed. In the first 2 weeks, will there be a vaccination date instead of just resuming class at one go? This will increase vaccination among children. And then for class resumption, well, for many parents, in February, many parents went back to the mainland when the summer holiday is being advanced. So if vaccination rate is still not 90%, and if you ask them to come back, that may not be good. So can there be online class so that until vaccination rate reaches 90%, then these parents can be asked to come back to Hong Kong? I think the Secretary may not be able to answer the second question. You may have to ask the Secretary for Education. Right, Secretary. Thank you, Chairman. First, concerning vaccination of elderly, we are concerned about that. Some time ago, Mr. Nip said that in elderly care homes, in the first phase, all elders in elderly care homes have taken the first jab, and that stage has been taken care of. And some elders have been infected. They cannot get vaccination right away. Some may need the second jab, some may need the third. So that work is now underway. I think for vaccination of the elderly, many elders are willing to receive vaccination, but some are staying at home, they cannot go out. Some may have other situation. So Hong Kong CSS together with Medical Health Association of Hong Kong have started a plan on offering vaccination at home. And some days ago, the government started a mandatory testing plan with those over 70 years old. If they have not been vaccinated, we'll go to their home to vaccinate them. So we are using all different ways to enhance vaccination takeout, and we are monitoring the situation. Besides, Chairman, you are right. Whether there can be online class and so on, we will forward your questions to the Education Bureau. At the beginning, if there are children who are not vaccinated yet, can there be vaccination in school? I think we can ask the Education Bureau to consider. I think this is a good suggestion because now class has not been resumed yet. And once class is resumed, there will be many students in school. Then I think there will be more people going for vaccination. We'll see what the Education Bureau thinks about the overall situation. Thank you. Colleagues, we only have 5 minutes left. 4 more members would like to ask questions. So may I ask all 4 members to ask questions at one go? Then Secretary, can you give written reply to the questions? If there is time left, then you can use it. Otherwise, you can provide written response. Elizabeth Quad, Regina Ip, Chan Yong, and 1 more member. Okay. Thank you, Chairman. A few questions. Number 1, many confirmed patients complained to us that they cannot report their infection certificate. Some elders don't know how to do it because they have to do it online. Even if they have reported, they have not received isolation order or any notice. And there's no telephone number that they can use. So if they can't get isolation order to report, they can't get sick leave certificate, they can't work. And then in relation to vaccination, they don't know whether they can take the 3rd jab or further jab. So I think you have to solve this problem. Otherwise, what should be done? Besides, just now Dr. Lam asked a question. You said antibody tests should be done. So should members of the public pay for the test themselves? Many residents are worried about new mutant, for example, SF, XE, and so on. Sorry, next, Mr. Chan Yong. Chan Yong? Can you hear me? Yes, please go ahead. Thank you, Chairman. A simple question. Now we want to boost vaccination takeout. It takes time. For elders and children, we are most concerned about them, especially in elderly care homes. What is the most effective and powerful way so that elders, children, and their parents will feel assured? So when class resumes, then people will be comfortable to take vaccination. Okay, Mr. Yao Tat Kan. Thank you, Chairman. I'll be fast. I want to declare that I am a member of Hospital Authority. I have also asked a question about oral medicine in HA meeting. The efficacy of the 2 medicines is different. So should we use the better one? We should not think that we have to use all that we have bought. We should use the most efficacious one. And if there is the 6th wave, now the Hospital Authority has outreach teams. And also oral medicine can be used, but then there will be a time lag. So can we apply telemedicine in elderly care homes so that oral medicine can be prescribed immediately? Thank you. Secretary, 1 minute is left for you. Please answer the questions as soon as possible. If you can't complete your answers, please give written reply. Chairman, I know that members are most concerned about oral medicine, so I'll defer to Hospital Authority to comment. Yes, thank you, Chairman and members. In Hospital Authority, we are already using the more efficacious one, the one starting with letter P. That is the first line medicine. Our colleagues know about this guideline. Unless if that is not applicable, then we'll use the less effective one. As for elderly care homes, thank you, members, for your comments. We will consider. Now, every day, we liaise with elderly care homes and we know about the newly confirmed cases. We will prescribe medicine. Chairman, Elizabeth Quad said that there are cases where people cannot report. Are you referring to the RAT platform? Well, some members refer to similar issues. So, Chairman, we'll ask D of H to follow up. Thank you, Chairman. Okay. Then we will conclude this item here. Thank you, Secretary and Hospital Authority colleagues. We will end the discussion of this item. Item 6 AOB. There is no AOB. I declare the meeting is adjourned here.